Gentlemen, Dr. Clara Vance here. If you still think of self-pleasure as just a quick 5-minute stress reliever, I have an urgent reality check for you. You're unknowingly throwing away the best natural tool you have to reclaim your performance. Too many men over 50 make the mistake of rushing through it, fueled by secrecy or a sense of guilt. But here's the clinical truth. You're essentially training your nervous system to fail when you're actually with a partner. Today, we're changing that for good. I'm going to walk you through my clinical protocol called Steel Intervals. This isn't some magic trick, it's pure vascular therapy. If you follow this regimen exactly as I lay it out, you won't just restore rock-solid firmness, you'll retrain your body to last an extra 10 to 15 minutes. But to make this work, I need you to be completely honest with me about your biggest hurdle right now. Let's get clinical. Drop a 1 in the comments if your main concern is weak erections. Drop a 2 if your issue is ending too quickly. Don't let embarrassment hold you back. Post your number right now, and let's start this transformation together. I want us to have a completely honest conversation. The reason your performance has dipped lately isn't just about getting older. It's about how you've been conditioning your body. Most men fall into what I call the fast food error. Think about it for a second. What does your typical routine look like? You're likely rushing through it in 3 to 5 minutes, maybe in the shower or right before bed, just looking for that quick hit of dopamine to decompress. It seems harmless, right? But medically speaking, it's a total disaster. When you repeat this pattern, you're literally rewiring your brain. You're creating a neural reflex that trains your body to think, the moment there's arousal, I need to finish immediately. Essentially, you're training yourself for premature issues. You're turning your sexual health into a sprint when it really needs to be a marathon. But the damage isn't just psychological, it's physiological. And here's a clinical concept I need you to burn into your memory. Disuse atrophy. Listen closely. Your anatomy isn't exactly a muscle, but it functions like one. To maintain its size, girth, and elasticity, it requires oxygen. And the only way for that oxygen to reach the deep tissues is through a full, sustained erection. If you're finishing in 5 minutes, that oxygenated blood barely had time to circulate. There's no real cellular nutrition happening. Over time, if you don't keep that blood flow active for at least 15 to 20 minutes, the internal tissues start to suffer. They become fibrous, lose elasticity, and develop microscopic scarring. That's why many men notice shrinkage over the years. It's not aging, it's a lack of proper vascular pumping. So, gentlemen, it's time for a mindset shift. I want you to erase the idea that this is a dirty act or a guilty habit. It's not. Starting today, we aren't calling this masturbation. We're calling it vascular physical therapy. This is a medical maintenance procedure to prevent your body from breaking down. It's about health. It's about self-respect. And it's the only way to keep your vitality intact for decades to come. Before we move into the practical technique, I need your full attention. If you skip this step, all the effort we put into our vascular physical therapy will be for nothing. There is a silent enemy destroying your sensitivity day after day, and the worst part is, you've invited it into your most private moments. Let's talk about the biology of your skin. In your 20s, your intimate tissues were resilient, thick, and elastic. They could handle almost any friction. But after 50 or 60, the landscape changes drastically. Collagen levels drop, natural hydration decreases, and that skin becomes incredibly thin and fragile, almost like tissue paper. This is where many men make a fatal mistake. Dry friction. Out of habit or a sense of urgency, many men use a dry, rough grip. When you do that to mature skin, you're causing invisible microabrasions. Your body, in its wisdom, tries to protect itself by building up a thicker layer of keratin, essentially an invisible callus. The disastrous consequence? You are killing your nerve endings. Literally, you are desensitizing your own instrument. If you condition yourself to that strong, dry grip, your brain won't feel enough stimulation when you're finally with a real partner whose natural lubrication is soft and delicate. Your brain will ask, "Where is that heavy pressure I'm used to?" And that's exactly when the erection fails at the moment of truth. That's why the solution I'm prescribing today is mandatory. You must simulate a natural biological environment. You need a conducting agent. Ideally, you should use a water-based lubricant. It's neutral and hygienic. If you prefer something natural, coconut oil or olive oil are excellent alternatives. These oils allow your hands to glide without damaging the skin, hydrating and protecting those delicate tissues. By eliminating aggressive friction, you allow your nerves to recover and wake up to softer sensations again. This is vital for your sexual future. I want to make a gentleman's agreement with you. I don't want you hurting yourself anymore. I want you to treat your body with the respect a man of your experience deserves. Please, make me a promise. No more dry friction. Go to the comments right now and type the word protection. By writing it, you're signing a contract with yourself to stop the damage and start the care. I want to see how many responsible men we have in this community. Type protection below, and let's move straight into the interval technique. Now that your hands are protected and your mindset is right, let's get into the technical phase. I want you to clear your head of that old habit of racing to the finish line. If you went to the gym to lift weights, you wouldn't just walk in, lift the heaviest plate once, and go home, right? That doesn't build muscle. It just causes injury. The same logic applies to your sexual performance. For this vascular physical therapy to work to actually thicken and strengthen your erection, we're going to structure this like a professional workout. We're breaking this session into 3 rounds. Your goal today isn't to climax. Your goal is to keep oxygenated blood inside the chambers of your anatomy for as long as possible. Let's start with round 1, sensory warm-up. This is where most men fail due to impatience. I want you to begin with very slow, gentle, and rhythmic stimulation. Do not aim for full rigidity yet. Forget about trying to get rock hard in 10 seconds. At a certain age, that is biologically counterproductive. In this first round, your goal is simply to wake up those dormant nerve endings. Using the lubricant you've chosen, use long, deliberate strokes. Close your eyes and visualize the blood flow moving from your core down into the pelvic region. We're looking for an erection at about 50% or 60% capacity, that state where there's volume, but the tissue is still flexible. Stay here for 3 to 5 minutes. We are convincing your arteries to dilate without stress. Think of it as a massage for your circulatory system. Breathe deeply and feel the vitality returning to your body, with 0 pressure to finish. Once you feel that warmth and the blood filling the tissue, we move to the next level. Welcome to round 2, controlled acceleration. Now, we're going to simulate the real-world conditions of an intimate encounter. I want you to increase the speed slightly and apply a firmer but still well-lubricated grip. Your objective is to bring that erection from 60% up to 80% or 90% of its maximum capacity. Feel the firmness increasing and observe how your body reacts. But, and this is vital, stay extremely alert. In this round, you're playing with fire, but you aren't going to let it burn you. I want you to push your arousal upward, climbing that mountain of pleasure until you see the peak. You're looking for that precise moment, that physical signal that tells you, if I go for 10 more seconds, I won't be able to stop. That is the point of no return. Your mission in round 2 is to reach the very edge of that cliff. Feel the maximum power. but do not cross the line. You are training your brain to tolerate high levels of pleasure without triggering the ejaculation reflex. And so, we reach the moment of truth. You're in round 2, your arousal is at 90%, and you feel that unmistakable tingling sensation warning you, ejaculation is imminent. You are standing right on the edge of the cliff. What do you do now? The instruction is simple, yet radical. Stop. Release everything. Hands off. Physically detach yourself from any stimulation. But be careful, gentlemen, because this is where the fatal error happens, the one that ruins decades of effort. Pay close attention, because you've likely been doing this wrong your entire life. When a man tries to hold back the urge to finish, his primal instinct is to contract. You tighten your glutes, your legs, and most importantly, you tense your pelvic floor, that muscle you use to stop the flow of urine. You think that by closing the gate, you'll prevent the release. As a doctor, I have to tell you plainly, that is sexual suicide. By performing a standard Kegel, squeezing inward during a moment of high arousal, you spike your intra-abdominal pressure. You're essentially squeezing your prostate like a tube of toothpaste. That tension sends an urgent internal fire signal to your brain, and instead of delaying ejaculation, you actually accelerate it. Tension is the best friend of a fast finish. To last longer, you need to do the exact opposite: active relaxation. Here is your new secret weapon, the reverse Kegel. Instead of squeezing in, I want you to follow these steps. Take a deep breath through your nose, directing the air toward your lower abdomen, not your chest. Feel your belly expand. While holding that breath, perform a gentle push outward with your pelvic muscles. It's the same motion you make when you want to begin urinating or when you're trying to relax and pass gas. It's not a violent strain, it's an expansion. Imagine you are trying to open the pelvic floor and slightly drop the testicles. What happens biologically? It's fascinating. By pushing outward and breathing deeply, you instantly activate your parasympathetic nervous system, your body's emergency brake. You're telling your brain, everything is calm, there is no danger. It's almost like magic. Within 10 to 15 seconds of this gentle push, that uncontrollable urgency vanishes. The feeling of, I can't hold, it evaporates, but because the blood is still there, your erection does not disappear. You remain firm, but now you have total control. Master this steel movement, and I promise you will be the absolute master of your time in the bedroom. You've survived the edge. Congratulations. You used the reverse Kegel. That urgency to finish has vanished, and your erection is still there, firm and under your total control. Now, breathe. Take 30 seconds to maintain that calm. What's next? Are we done? Absolutely not. This is where the real magic of reprogramming begins. Now that you've stepped back from the danger zone, I want you to restart the cycle. Begin gentle stimulation again, build the intensity, approach the edge, and stop once more using the reverse Kegel. Your mission today is to complete 3 full rounds. This will take you between 15 and 20 minutes. I know for many of you, used to the fast track habit, this feels like an eternity, but medically, it's a non-negotiable requirement for rescue oxygenation. Visualize the interior of your anatomy. The cavernous bodies are like thirsty sponges. In a flaccid state, the circulating oxygenated blood is minimal. Those tissues are essentially living in a state of semi-suffocation. Over the years, this lack of oxygen causes elastic fibers to die off, replaced by fibrous tissue. That is exactly how shrinkage happens. By maintaining an erection for 20 minutes through these intervals, you are bathing those cells in a torrent of fresh blood and nutrients. It's a regenerative treatment that forces the tissues to expand and remember their original capacity. But there's a second vital component, the mental factor. During these 20 minutes, I have one strict prohibition. Turn off the screens. No more pornography. High-intensity visual overstimulation has destroyed the performance of millions of men. If you condition your brain to only get aroused by frenetic imagery, when you're finally with a real partner, your brain will say, "This is boring," and your erection will fail. We need a digital detox. During these rounds, close your eyes, reconnect your brain with your body. Feel the temperature of the lubricant, the texture of your skin, and the pressure of your hand. Use your imagination. By doing this, you are repairing your neural wiring and reclaiming lost sensitivity. It will be tough at first, like quitting sugar, but stay patient. With every screen-free session, your brain will clear out the clutter, and you'll feel that genuine desire you thought was gone. So, gentlemen, 3 rounds, 20 minutes, 0 screens. Fresh blood for your cells and pure connections for your brain. Once you finish the 3rd round, we'll be ready for the final step. You've reached the 3rd and final round. You've completed your intervals, oxygenated your tissues, and demonstrated mental control of steel. Now, and only now, you have my clinical permission to cross the finish line. In this round, if your body calls for it, you may release the tension. Don't view it as just pleasure. Visualize it as a filter flush. For the mature prostate, the periodic expulsion of seminal fluid is healthy. It prevents fluids from stagnating and causing inflammation. Enjoy the moment and feel your body enter a state of deep relaxation. However, this is where 90% of men make a costly mistake. After finishing, most men feel that drowsiness triggered by endorphins and just want to sleep. Don't do it. Falling asleep immediately is a risk for your urinary system at this age. We need to activate the post-act safety protocol. The first step is non-negotiable. Get up and go urinate immediately. You might feel like you don't have the urge, but you must try. Your urethra is a shared pathway, and after ejaculation, there are always traces of sugars and fluids trapped inside. Additionally, during physical manipulation, bacteria can gather near the urethral opening. If you fall asleep like that, those bacteria have hours to multiply and travel toward your bladder or prostate, causing what we call a retrograde infection. By urinating with force, you perform a mechanical sweep that flushes out any residue. It is your best natural defense. Finally, to close the recovery cycle, we have thermal hydration. Do not reach for ice-cold water. The cold constricts the blood vessels we just worked so hard to dilate. Instead, drink a large glass of lukewarm or room temperature water. Your body has spiked its metabolism, and your kidneys need fluids to filter out the metabolic byproducts. Warm water supports the relaxation of the pelvic muscles and facilitates kidney function. Drink slowly, feeling your system rehydrate. Only after you've urinated and had your water do you have my blessing to head back to bed. Today, you didn't just perform like a man. You took care of yourself like a professional. Congratulations. Gentlemen, taking care of your intimate health after 60 isn't about vanity. It's a matter of dignity and self-respect. You have every right to live with vitality until your very last day. Never let age take that away from you. Today, we fix the mechanics with steel intervals. But remember, even the best engine won't start without fuel. For this technique to be explosive, your arteries need raw materials. In my next video, I'm going to share the recipe for my nitric oxide bomb shake to reactivate those morning erections. Subscribe and hit that notification bell so you don't miss it. I know the reverse Kegel can be tough to master. If you want an exclusive, practical, deep dive video to learn how to control that exact muscle, type the word technique in the comments right now. If I see enough interest, I'll record it for you next week. This content is for educational purposes only and is not a substitute for professional medical advice.